Here's a classic gallbladder pitfall, but it's easy to avoid if you know its artifacts inside and out. Hello, welcome to EcoMap, the practical, easy, and useful ultrasound resource for general practitioners. And today, indeed, we're going to talk about something that's tricky in practice, especially when you're just starting out. And that can lead to a lot of doubts and confusion. And yet, it's easy if you master it and understand it. Specifically, the principle behind artifacts. So just a reminder that right now, your ultrasound training is free, a beginner's course in ultrasound where, in fact, we talk at length and in detail about artifacts and how understanding them well can really help us. How does an ultrasound machine work? Why do we get this type of image? And how? By really understanding how the ultrasound machine works. And by really understanding specifically why. Some images are actually false images. Why do we avoid falling into these traps? And that's exactly what we're going to cover today in this video. So we're going to talk about a 55-year-old woman who comes in for a consultation because of chronic abdominal pain that's been going on for several months. Abdominal pain that's mostly triggered by meals, mainly occurring after eating. And so during the clinical exam, of course, we always examine our patient because, in my opinion, ultrasound is absolutely inseparable from the clinical context if you want to be accurate and make good diagnoses. And on examination, we find a slightly diffuse, somewhat generalized abdominal tenderness, along with a generally distended abdomen. And there's pain in the right upper quadrant. So, of course, right away, pain triggered by meals, pain in the right upper quadrant, we're going to think about the gallbladder. And so, since the ultrasound machine is right next to our exam table, it's very quick to just grab the probe. And here are the images we get. So this is a sagittal view. Actually, it looks more like a different view, a coronal view, in fact, a coronal or frontal view. That is, along the axis of the forehead, along the axis of Caesar's crown. So is it intercostal? On the right, I adjusted the position of my probe a little to avoid having a shadow on the image, to get better images. So as you can see here, of course, we have the top and bottom of the patient, meaning the head and the feet, with the liver here, of course, and here is our gallbladder, which is present right here. What immediately stands out, of course, are these two highly echogenic images seen in the gallbladder. The first thing that comes to mind, obviously, is the presence of lithiasis. We'll complete our exam with a bit of color imaging, since you should always use Doppler. Whenever you perform an exploration, it's essential to use Doppler. Let me remind you, as soon as you found them, immediately you need to, well, not immediately stop. First, you analyze your image, but you should always finish your exploration with a Doppler scan. Doppler. It's easy, it's informative, so you should do it every time. And there you have it. So we get two images. Two highly echogenic images, two rounded images. So apparently present in the gallbladder and is a calculi. So it would be very, very easy if you were a beginner and not at all, trained in analyzing artifacts and understanding ultrasound images, to conclude with the diagnosis of gallstones. But listen, ma'am, you have two large gallstones in your gallbladder. We need to schedule surgery because that's why you're in pain. The stones are probably getting stuck, and that's absolutely, absolutely, absolutely not the case here. Actually, what should stand out to you already is that yes, these images are highly echogenic. Let's describe them in detail. Typically, following ultrasound semiology, there are two highly echogenic rounded images, but they don't show any shadow cones. Actually, in reality, they do show a shadow cone, but let's say it's what we would call an impure shadow cone. Unlike the shadow cones of calcified images, which would be a pure shadow cone, let's use plain language. So normally, it would be a black shadow cone, an anechoic shadow cone, but here, not at all. We have an impure shadow cone. We have a gray shadow cone. You can see that behind this image, you notice a gray shadow cone, and here as well, what we call an impure shadow cone. We'll come back to that. Our images are also highly echogenic overall. It's not just the surface of an image that will be highly echogenic. However, in the case of a stone, only the surface will be highly echogenic. In the introductory training, I explained this clearly. The ultrasounds, your echoes, will partly bounce off the surface and partly get trapped. You'll see, if you want more explanations, it'll be well explained in the training. This explains the highly echogenic surface appearance and the posterior anechoic area with a pure shadow. Here, we're imaging the entire image is highly echogenic with an impure shadow. An impure shadow, which you might not know, is actually a gas shadow. It's really not at all. It's not at all the same mechanism as the shadow, actually. The absorption shadow you might see, for example, with stones. Here, it's a reflection and reverberation shadow, two completely different types of shadows. It's a totally different kind of artifact. So if you know this, if you know the trick, you won't get fooled. And you don't end up thinking that, actually. There are two stones in a duct. Right away, you'll think shadow, impure, so gas, so the presence of gas. These are two air images, probably due to the patient's bloating and the position of the digestive tract at that spot, which is causing this. An image, a false image of a stone, an artifact image, that is actually an air image. Now, if we use a second trick that I like to share in my trainings, for the digestive tract, and especially for the gallbladder, here's an essential tip to know. Have your patients lie in the prone position. That is, you do your first ultrasound with the patient on their back, then you have them turn onto their stomach, and you perform a second ultrasound with the patient lying on their belly, because the stones will move and settle at the bottom of the gallbladder, which will now be positioned downward, because now gravity will pull everything downwards. So actually, the bottom of the image is here. And of course, as always, you have the head and the feet. But this time, the exam table is here since your patient is lying on their stomach. So the gallstone we saw earlier should have moved. The gas will also shift since it can move around. You're basically going to press on your patient's stomach by turning them onto their stomach. And the gas will move and your image will change. That's exactly what's happening here. Here, there's absolutely no question of there being two images inside the gallbladder anymore. We can see very clearly that our gallbladder wall is here, and actually, our images are separated by the digestive wall. Here, we can see the digestive wall, and these two images, highly echogenic with an impure shadow cone, are outside the gallbladder. They're actually inside the digestive tract. That makes perfect sense then. See how by fully understanding this principle of artifacts, you can, and also by knowing the trick of turning your patient into the prone position, you can very easily avoid a very, very, very common pitfall. Because I guarantee you, if you start exploring the gallbladder, you're going to come across these images and you'll start asking yourself questions. And especially at first, you'll have doubts, wondering if what you're doing is correct. And why is that? In the end, on the CT scan you ordered afterward, or the follow-up exam by a colleague you asked to double check, why can't they find the stones that looked so clear and so huge before? Well, there you have it. That's the explanation. So I'm convinced that this clinical case has taught you a lot, and that you now have a better understanding of artifact. And I'm absolutely certain that this is a trap you won't fall into again. There you go. It's learned. It's known now. Let me remind you that you have access to a free ultrasound training, and the link is in the description. I encourage you to click the link and join us. In this great training, we go over in detail pretty much everything. The basics of ultrasound and where I help you get started with ultrasound. Like the video and subscribe to the channel if you want more content like this. And I'll see you very soon on EcoMap.